sorry. How are you feeling?
I haven't been feeling too good lately.
Oh, I'm sorry to hear that. Have you been to the doctor recently?
No, not since I've been to the hospital a couple months back.
He had the flu. He could barely breathe, and we had to go to the emergency room.
Yeah, I was having a lot of trouble breathing, but that was probably because I was running around with my grandkids, and sometimes at work I have trouble catching my breath.
So where do you work?
I'm a construction field supervisor for the local construction company. Been there about 20 years already.
Wow, that's so great to hear. So, were you taking any medication to help you breathe before you went to the hospital?
No, nothing at all, but I did try to stop smoking cold turkey after I got out of the hospital.
Yeah, he lasted about 2 weeks.
Well, what's the point of quitting now? The damage is already done.
There are a lot of benefits of quitting smoking, but let's talk about your medical history right now. So I talked with your physician, and I understand that you have COPD. Do you know what that means?
Well, I think it means that my lungs don't work as well as they should, probably due to my smoking.
Well, COPD stands for chronic obstructive pulmonary disease. Your airway is constricted and there's inflammation, and this makes it hard for you to breathe. So basically, your lungs aren't getting as much air as they should. If we start to treat this effectively, it could really improve your quality of life. And if we don't, it could get much worse.
So what exactly do my inhalers do?
Well, they help to open up your airways. ProAir, which is a red inhaler, is what we call a rescue medication. You only use it when you really need to, like when you're having symptoms like shortness of breath, wheezing, or chest tightness. Floridil is like ProAir, but it lasts longer. We call it a controller medication. When it's used effectively, you won't need the rescue inhaler as often. So how are you using the ProAir and the Floridil?
Well, usually I use them together every day at the same time, usually in the morning and at night, but sometimes if I'm too tired or don't feel like it, I won't use them at night.
I try my best to remind him to use his inhalers, but he just won't listen to me. Maybe he'll listen to your advice.
Well, I'm glad to hear that you're taking the Floridil daily. To get the greatest bang for your buck, you should take it in both the morning and the evening. Also, the ProAir and the Floridil really shouldn't be used together. As I mentioned before, the Floridil is a controller, so taking that twice a day will help you to control your COPD symptoms. You should only use a ProAir when you're really experiencing some symptoms like shortness of breath and wheezing. It's also important that you take your medication as prescribed to get the most benefit. Can you show me how you use them?
Here, I brought everything.
Okay, well, we'll just start with this one. So, before you use a rescue inhaler, how often do you use this? Pretty much every day?
Yeah, usually at least once, maybe twice a day.
Okay, so you're going to want to shake it up before you use it. Well, you took the cap off, so we're good there. And you're going to want to hold it 1 to 2 inches away from your mouth and inhale after depressing.
Okay, that seems pretty easy. I think I can manage that.
Yeah, and once we get you well controlled, you might not be using this as frequently. So if you haven't used it in 2 weeks, you need to prime it before you use it. And you just basically 2 puffs into the air to prime it. And you need to do that when you get a new one as well.
Now this one, I open it up, just put the fancy capsule in there,
Okay?
and I close it, and then blow into it.
Do you break the capsule?
Sometimes I do forget.
Okay. It's very important to depress this button, because if you don't depress this button, the capsule won't be broken and you don't actually get the medications.
See, I'm not even getting the medicine.
Sometimes I press it though.
Okay.
That kind of seems like a lot to remember. Honey, were you paying attention to that?
I paid attention to everything. And I'll call the pharmacy if I can't remember.
We're always here, at least on regular business hours, but just in case, I'm going to provide you with a medication action plan, which tells you what to use and when to use it and how to use it.
Can I see that?
Sure.
So we can take that home with us?
Yes, that's for you to keep.
Great, I'll put it up on the fridge so you can remember.
Okay, it's also important to take proper care of your inhalers. Can you tell me how you're taking care of them now, like storage and information like that?
Well, usually when we go out, I give my wife the inhaler, the fast-acting one, because I don't like to carry it. Otherwise, it just sits on the windowsill at home.
You have the mom syndrome with the purse.
I carry it in my purse just in case he needs it.
That's good. And where do you store it at home?
Usually in the kitchen. I keep it on the windowsill so he always knows where to find it.
Okay. Well, I have a couple suggestions for you. It's good to put your medication in a place where you'll remember to take it every day. I put mine by my toothbrush. No, that's not true. My vitamins by my toothbrush to take them every day. But putting them on the windowsill can expose these to extreme temperatures. So, we get really cold winters and really hot summers, and these should really be kept at room temperature. So I would suggest maybe putting them in a cabinet where you have your bowls for breakfast, but not above the stove because that's also extreme heat. And also, do you ever clean this one?
No.
Okay, so once about every 2 weeks, you need to take out the canister and run this in warm water, just at your kitchen faucet for 30 seconds, ABCs through once, and then let it air dry, preferably overnight.
That sounds like a lot to remember. I hope you were taking good notes.
I can remember it all.
When you have the map too, so.
Yeah, see, we need to follow this.
So let's talk a little bit about your symptoms. There are 4 stages of COPD, so we want to see what stage you fit into so we can give you the proper medication. Based on the results of your test, it looks like you're in stage 2. Do you have any trouble breathing even when you use the inhalers? And if you do, what activities are you doing?
Usually not when I use them, but sometimes if I'm running around trying to chase the grandkids around the yard. But that's about it usually.
Okay, and how often does shortness of breath wake you up from sleep?
Usually not at all. Maybe once or twice every month or 2 at the most.
Okay, and do you ever have trouble breathing when you're just relaxing or sitting down?
No.
Okay, that's really good to hear. Now, how about immunizations? What vaccinations have you recently had?
Well, I can't really recall. I think the last ones I got was when I was a kid and my mom forced me to go to the doctor's office. But I thought that immunizations were for just the very young or the very old.
I've told him time and time again he needs to get the flu and the pneumonia vaccine. I read it on WebMD that people with COPD need those vaccinations.
And you're exactly right. People who have respiratory problems or smokers need to receive the flu vaccine every flu season, regardless of their age. And additionally, the same patients should receive the Pneumovax, the pneumonia vaccine, once and then once again after 65.
See, I told you.
I didn't realize that. Well, where do I go to get all these vaccines?
We can actually schedule an appointment right here.
Wow, the pharmacist can do everything, huh?
So let's get back to your medication. What other medications do you take?
That's it for me.
Wrong again. He's been taking this cough syrup for his cough for a while, and he's been taking Pepcid because he gets indigestion, and he's taking ginseng. I saw somewhere that ginseng can help with COPD. Is that true?
Well, as far as as far as the ginseng goes, there are some studies showing that it might improve lung function in some patients with moderate to severe COPD. However, these were very small studies, and a lot more research needs to be done before we can actually determine whether or not it's useful. So for now, let's hold off on the ginseng and see if we can get your symptoms under control with the medications your doctor prescribed for you. Now, about the cough, how long have you had it?
Probably about a couple weeks, but it kind of comes and goes depending on the weather. And typically, that's really only when I use the cough syrup is when it gets bad.
Well, coughing is a normal part of COPD. It kind of helps by acting like a defense mechanism, so it helps you get rid of excess mucus and the bacteria hanging out there. That can help you feel better, so suppressing that isn't always a good thing. It's important, though, to drink a lot of fluids like water, non-caffeinated and non-alcoholic beverages, and this will keep you hydrated and make the mucus thinner and easier to cough up. Maybe if we get your COPD under control with the inhalers, you won't cough as often. So just managing your medication might solve that problem. At this time, though, let's hold off on the Robitussin and get you back on track with your inhalers. And it's great that you're taking the multivitamin. And as far as the heartburn, how often do you get that?
Usually a couple times a week.
Okay, well, that could also be due to your smoking. So we should talk about some ways you can quit. But just in case, you should really make an appointment with your doctor. In the meantime, Prilosec OTC is a great over-the-counter product that can help you control your heartburn until you have a chance to make it into the doctor. And let's see, back to the smoking. So,
He needs to quit. What can we do?
well, quitting is sometimes really difficult for patients. How do you feel about quitting?
Well, I know smoking's bad for me. I'm told that every day, but it seems like it's so hard, and I've already been smoking for so long. I don't really see that there's any benefit to me stopping smoking.
Well, actually, that's not the case. Even for people that have been smoking all their lives, there are still benefits no matter what age they are.
Really? How so?
Well, starting with the first 20 minutes, your blood pressure and pulse return to normal. After 8 hours, your CO2, your carbon monoxide and oxygen levels normalize. 3 days, you'll get your sense of taste and smell improved. Circulation improves after 2 to 12 weeks. 1 to 9 months, your cough and congestion can subside. Let's see, your risk of a heart attack decreases to half of that, decreases to half of what it is now, between 5 and 15 years, and your risk for cancer and stroke also decrease over time.
Wow, who would have thought that? Now I'll actually have to taste my wife's cooking.
Well, that's great news. I never knew that all of that was possible.
Yes, it all is, which is why we really want to encourage you to quit smoking and educate you on the benefits of it. I just have a few more things to clarify. How many years have you been smoking?
Forever.
Yeah, probably since I was 18 or 19, so over 30 years.
And how many cigarettes would you say that you smoke each day?
About a pack a day.
More like 2.
All right, no one ever said quitting was easy, but it's great that you're thinking about the effects of smoking and the benefits of quitting. I can tell you that there are a lot of smoking cessation aids. And have you tried any of the nicotine replacement options?
No, just tried cold turkey, and it was really hard.
Yeah, that can be pretty rough. I have some pamphlets I'm going to send home with you to just some education on smoking cessation. And there are aids, like quitting cold turkey. It's an uphill climb, but some of these smoking aids and different habits can make the uphill climb a little easier.
Well, I'll definitely have to take a look at that. We appreciate you giving us the information.
Wonderful. So let's go back to your meds. Let's see how your symptoms. Let's see if we can get your symptoms under control. If you're still having trouble with your current regimen, we can talk to your doctor and maybe get you just switched over to something else.
That sounds good.
Do you have any questions about any of the information we discussed today?
No, not really. I think that kind of talking about it to someone aside from my wife made it a little bit easier to kind of comprehend how important it is, and I think she has been trying to help me all along, but I just didn't want to realize it, so thank
He's
you.
finally listening to somebody.
Okay, well, I'm glad we got to talk about this today. I'm going to call your doctor so that we can get the prescription for your immunizations and we can schedule an appointment to get you set up for those, and you should schedule up a follow-up for your heartburn. And give me a call if there's any questions or anything you need, and we'll set up a follow-up and continue working this out.
All right, sounds good.
Thank you.
you.